Capitol Report is a production of Senate Media Services.
This week, key lawmakers in the House and the Senate dive into the staffing crisis in long-term care facilities. Plus, Senate Republicans push for tax relief and greater funding for roads and bridges. Stay tuned for this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. Key senators recently called a press conference to sound the alarm on the significant staffing crisis facing nursing homes and long-term care facilities.
Our long-term care facilities, our assisted livings, our nursing homes have been just decimated by COVID, and we are in a real crisis. They were in a crisis even before COVID. They were down 9,000 employees, open vacancies for those folks to help take care of our most vulnerable. Now there are 23,000 vacancies, and our facilities, our assisted living homes, are struggling to find people to come and work to help take care of these folks, and they're having a hard time retaining these folks also.
Can I really give these people the care that they deserve after working 50 hours a week? In early January, I worked over 78 hours in a week. I was supposed to be supervising a home, but almost every one of those hours was spent in direct care.
If we don't care, let's just say it and put it on the table and do other stuff. Let's just say it. Let's be honest.
This is the worst time ever in the history of Minnesota for people who need to be cared for. We've never had nursing homes closing like they're closing, and they're closing. We've never had group homes where 4 people live that are closing and hoping they can find someplace else to send these folks.
The crisis in staffing for long-term care facilities is alarming lawmakers, and a $322 million Senate proposal may help alleviate the shortage. Joining me in the studio is Senator Jim Abeler, chair of the Human Services Reform Committee. Thank you for being here.
Good to be here again.
At the press conference where you and several of your colleagues outlined this proposal that I referenced, you said, quote, "This is the worst time ever in the history of Minnesota for people who need care." Why are you so concerned?
I wish I could have said it stronger. It is so challenging. The whole industry that supports nursing homes, assisted living, people in group homes with disabilities, and the whole home care world was on a challenging basis anyway. It was rickety. Then you had COVID and closed businesses and cash flows and people afraid to go out, staff getting sick, you know, and all the challenges. It's only exacerbated things, which has created a massive workforce crisis. And everybody and their brother is paying more money than you can get in long-term care, which is some of the most important work of anywhere. Places are actually closing, turning out people from group homes. Nursing homes are closing. And now here we are. And so, yeah, you're the legislature, figure it out. And so we've actually put our mind to it a bit, and that's what this was the beginning of doing.
And so let's talk about this rescue package, because one of the things it would do is provide retention bonuses for people who are currently employed in eligible facilities of $1,000. It would also provide $1,500 bonuses to attract new workers in 2 installments, and also provide money for training and uniforms, with the goal of getting as many as 20,000 new workers in this industry. But this is just one-time funding. Is this a Band-Aid?
Well, if you're bleeding, you want a Band-Aid. And if it's bad enough, you want a tourniquet. So this is a start. And it's amazing. So we're proposing to give 206,000 workers $1,000. That costs $206 million just by itself. And so we're going to train hopefully 20,000 new people. We need 40,000 people in the industry. And so we'll give them a bonus to start and then pay their training costs. So it's such an honorable, good profession to be a certified nursing assistant or be a service professional as you're helping people, and the joy and the rewards they feel, they are simply the salt of the earth. And if only they could make a living, they would stay forever. But they can't, and they actually want to buy food and buy gas and pay their mortgage. It's a real challenge.
So that goes to my next question, because I've heard people testify before your committee that they love this work. They're dedicated to this work, but they're having to work multiple jobs in order to pay their bills. And as you said, and I know you know, McDonald's or manufacturing food service, many other industries are paying more than these jobs do. So can rates, wages, salary, benefits, can it increase?
Well, we're working on that in our committee. We've got a great committee. There's a bipartisan crew. We've got freshmen and veterans, and we're bringing in the public. We're actually doing work in our committee, asking advice about what flexibilities can we have in workforce so we can get by with fewer people. That has to be the future. Can there be a more comprehensive package of services done? That's the PACE program, which is where Presbyterian homes would just agree they're going to take care of me, and they're going to provide my assisted living and my nursing home and my health care kind of as a wraparound package. It's supposed to save 5%. If we can save that 5% and turn it back into wages, that's a start. But it's, and so that's what we really have to go to, looking at not just today, but into the future. How do we get people to stay? And that's the riddle, but we have to get it figured out.
And is there a way to increase the salary and the benefits so that people would have a living wage?
And we talked about that today in our committee. What's it going to cost? The bad news is, if you had $600 million to spend, like $200 now and then $400 in the future, that's enough to give all those workers a $1 raise. $600 million. It used to be a lot of money. So the problem is actually the solution's in the billions, and we're going to see, at least someone says, what's it going to take? Now here's what it's going to take to stabilize it, to get people from $15 to $20 and maybe some benefits so they can hang in there and make this a career. It's really a hard problem.
And I'm guessing that another issue perhaps may be demographics, because we have a fairly large elderly population. We also have the baby boomer generation that is aging, and even my generation is going to be retirement age in not that many years.
A long time from now.
So, do we have enough workers, and how do we incentivize them? You know, the Senate did pass money to recruit more police officers. Do we need to have an ad campaign that praises this kind of work?
Well, sure. And so to the ad campaign idea, the governor had a proposal. He spent $3.4 million to try to recruit 1,000 CNAs. He attracted 700 some, and a handful have made it through the program already. So that's good there's that many. But there was money for marketing he didn't use. If this is ever going to work, the Senate proposal, as great as it is, it's actually 2.5 times as much money as the governor proposed to put into programming like this. We're going to actually have to agree on how we're going to do this together. Not as a governor proposal, House proposal, Senate proposal, but as the three groups working together. So there's money sitting in a bucket somewhere for marketing, a couple $1 million. That would be a really nice campaign. And so, yeah, it can work. And then also we need to find, just to make you feel even worse, this is all very discouraging. There's only 6,000 people, new workers, to come and do everything in Minnesota, according to the demographic people. The police, teachers, everybody. And so can we find a way to maybe help people that are homeless, to draw them in, and so they can have a ladder to success? People in substance abuse programs, people that are underemployed or just kind of gave up trying, could they come in and work part-time? Could they enjoy the joy of working and serving somebody? Because we need more people, more than is out there, and we now have to have incentives. And so it's a big problem. Stay tuned. But the future of your grandma and maybe even you is at stake. And that's what we're trying to fix.
And so some of what you're laying out there are new and creative ways perhaps at looking at this issue. I mean, your committee, the Human Services Reform Committee, is always looking for ways to improve, streamline, make more efficient with less tax dollars. Besides these ideas you just presented, are there others on the horizon, ways to do more with less?
Yeah, more. So the money is a different discussion. And we spend more money than almost any state on our Medicaid programs, and still we're challenged. And maybe they're way better. We're trying to figure out that. But there's ways to do shared services. Can a group home have 5 people instead of 4, or maybe 6 if it's accommodated? And if the people are happy with it, maybe you can have the same amount of staff. Ideas like that would help to just take care of it, just to keep it together. So we have to find a way. You can't have all the money you want because it's in the billions. So we have to find a way to do with the money, most of the money we have, and the people we have, and improve our system. Sometimes a crisis is a good time to make things even better. People pray that we can find a way to work around here to keep our seniors and our vulnerable people with disabilities safe. It's the time.
One final thing, I've been reading about multi-generational housing. And I wonder if that's perhaps an opportunity where you have young folks and older folks and they can all kind of work together and help each other out, especially since we have a housing crisis. You know, if is that a direction? Is that a new way to think about this?
I think the world is changing. I think that for some people it makes a lot of sense. My sister lived with my parents. They had a separate mother-in-law apartment, and she was down there every day, and my dad passed away, never had to leave the house. A little home hospice at the end, and God bless the VA. So of necessity, these things may have to happen, and I think people may have to take a little more responsibility for their loved one. And when they're closing some of these group homes and nursing homes, where are the people going anyway? Back home. Like, oh no, we had a guy who was 78 worried about how to take care of his 53-year-old son. So for some that makes sense, to some that doesn't. Stay tuned, more to come, and we're keeping working.
Senator Jim Abeler, it's always a pleasure. Thank you.
Thank you.
A bill that would allow Minnesota to join the Interstate Nurse Licensure Compact cleared its first Senate hurdle.
Senate File 2302 would authorize Minnesota to enter into the Nurse Licensure Compact. The Nurse Licensure Compact increases access to care, protects patient safety, and reduces cost while supporting state-of-the-art healthcare delivery. The Nurse Licensure Compact allows registered nurses and licensed practical vocational nurses trained to the national standards to have one multi-state license.
We are watching the changes in healthcare. So nurses are providing telehealth, they're providing remote health, they're providing EICU care. All of these things take our patients outside of Minnesota. We think it's critical that we support the nurses so that they can provide that care and continue to stay with their patients beyond the Minnesota borders.
Embracing the compact allows our virtual nursing teams to continue to provide immediate support and oversight to other hospitals experiencing staffing needs and fluctuations in patient acuity.
It seems like the bottom line is that there's a floor and then there's a ceiling. It seems like Minnesota is a ceiling state and some other states are floor states. I have relatives who live in Tennessee. They're grateful for Mississippi because it's number 50 compared to 49 in some of the statistics. And so that remains my concern. But
we need to support those who have been on the floor working with the patients who, and that's who I trust, not the nurses, the ones saving lives, not the ones pushing paper. A vote in the favor of this bill is a slap in the face to nurses in this state.
Nursing is a calling. My colleagues and I are called to care for patients at their toughest moments. So it's no surprise that the difficulty of the pandemic has inspired more Minnesotans to get their license. Rather, what we face is a shortage of nurses willing to work in unsafe conditions that jeopardize the health of their patients, their license, and their mental health.
For another perspective on the challenges and potential solutions in the staffing crisis facing Minnesota's nursing homes and long-term care facilities, I spoke with the chair of the Human Services Committee in the House, Representative Jennifer Schultz. There is a staffing crisis in caring for people, whether it is people with disabilities, the elderly, or the infirm. Big picture, in your view, how dire is this crisis?
Well, first of all, thank you for having me on this Capitol Report episode. Really glad to be here to talk about something that's really important to our state and to many of my constituents, and that is long-term care. And we definitely do have a staffing crisis. Actually, we had it before the pandemic. We have over 13,000 job openings in long-term care in healthcare occupations. And we are determined to start tackling that issue this session.
Long-term care facilities have been sounding the alarm about the difficulties in finding and retaining staff. According to MinPost, 76% of providers are limiting admissions. The percentage is 90% in greater Minnesota. I've heard testimony that some facilities are actually closing. Will incentives proposed by Republicans, they had a press conference last week, incentives like bonuses, grants for training, and loan forgiveness, is that a positive move in the right direction?
Well, we need to start somewhere, so it's a good start. We did put in over $50 million last December and earlier this year into a fund to help retain healthcare workforce and to provide bonuses. And we found that worked somewhat. It took people from other areas of healthcare into other areas of healthcare. So we really need to bring new people in to the healthcare workforce and to the caring professions. So one thing that we need to do, besides the Senate is offering one-time bonus payments, that is not a long-term fix. So what we're looking at in the House is to increase the reimbursement rates for providers and the long-term care facilities so they can then pay higher wages and offer a greater benefit set. Benefits like tuition reduction or repayment, child care, medical, long-term care insurance, retirement bonuses. So we really want to do a lot more long-term on a permanent basis to attract new people to the caring professions.
And as it stands right now, do most of these positions lack some of those benefits that you laid out, retirement savings, health care plans? Do many of these positions lack those sort of basics that many professional jobs have?
I believe many of them do, especially if they're entry level or mid-level. So I think that because historically reimbursement rates for programs like Medicaid or medical assistance have been low and not keeping up with medical inflation, a lot of providers are just not able to offer that benefit set. So we need to get help from the federal government and put more investment at the state level into these reimbursement levels that hopefully will translate into higher wages and greater benefits.
Now, you mentioned that the wages need to come up, that we need more workers to come into the system. We're also looking at a demographic shift with baby boomers aging out and perhaps fewer younger people even available. So there's going to be a lot of competition for other jobs. Why should people pursue these kinds of jobs?
Well, many people find them very, very rewarding, even though they can be grueling. They're very rewarding. And so I think people want to have value in their professions, and many want to go into this occupation even with lower salaries. But we need more people moving to Minnesota. And so we need to attract a working age population to Minnesota because we do, as a state, have a higher age demographic. And so we need to make Minnesota an attractive state, and we offer a lot of great benefits, and it's a beautiful place to live. But we should be opening our arms to refugees and others who want to come to Minnesota.
And in a prior answer, you mentioned raising rates and Medicaid and working with the federal government. I know that this can be very confusing for people trying to navigate when they need services for a loved one. What can the state be responsible for when it is a collection of state programs and federal aid and all of that? Can you explain that to the layman?
So right now, Medicaid is a state and federally funded program. In Minnesota, it's 50-50. So whenever we increase the reimbursement rate for Medicaid, for instance, 50% of that will be paid for by the federal government. And that's why, as a strategy to increase that reimbursement rate, we're going to get 50% of that paid for by the federal government, rather than these one-time bonus payments, which is all state general fund. That's why it is really attractive to increase reimbursement rates, because we're getting the subsidies from the federal government.
The strategy up to now for the people as they get older is to age in place. With a shortage of caregivers to just come in and do the daily tasks or other things, does the strategy of age in place need to change?
I think a strategy of making sure people can stay in their homes as long as possible. That's what most people prefer to do, is the right strategy. It is much cheaper to provide home and community-based services for people to stay in their homes than it is to put them in a nursing facility. So it is the right strategy. All states are pursuing that. Minnesota historically has been a leader in this area, and we just need to make those investments. So states like Washington State created a public-private trust fund to provide people some coverage for those long-term services and supports to keep them in their homes longer. Minnesota should be pursuing something similar. So whenever we can make those investments, and we received over $650 million from the federal government last year to invest in home and community-based services, we're going to see that pay off, and we need to continue those investments. But we really need to change how we think of the caring professions. That we need to value them more, and that means prioritizing those investments and making sure that they get higher wages and greater benefit set. We've really undervalued the caring professions, and they're so vital to our community in Minnesota and across the country. But we also have to kind of decide how we're going to change, for example, housing development. So we can provide multiple generations that can live together and care for each other. We really need to change how we provide housing and make it much easier to age in place by, having mother-in-law apartments or accessory dwelling units on the same property. So really change even apartment buildings that houses young college students, for instance, and older adults so they can help each other.
Yeah, I have read some about some of the ideas for communities like that of mixed people to help each other out. Oh, in the Wall Street Journal this weekend, there was a very fascinating article about Amy Goyer, who is the family and caregiving expert for AARP, which is the American Association of Retired Persons. She actually had to file for bankruptcy because of the expenses she incurred in caring for her two elderly parents. And it brings up the question of the unpaid work that so many people do for family members, or they go into debt themselves in order to provide services that maybe are available somehow, but the web of understanding how to access is so challenging. What are some ideas to perhaps help with that?
Yeah, I can really relate because I'm in that sandwich generation where I'm taking care of young children and looking soon to be taking care of aging parents. And so it is a real problem. And what first needs to happen is we need to make sure employers can provide paid time off. So paid sick time, paid time to do this caregiving so people don't lose their job and they can maintain their salary or wages. That is really vital to making sure people don't have to declare bankruptcy, but also valuing that more. So maybe tax credits or some sort of financial aid to get them through those periods where they do have to provide more care to their aging parents.
Representative Jen Schultz, I want to thank you so much for your time today.
Yes, thank you for the interview. Really appreciate it.
This week, Senate Republicans introduced a proposal that would provide permanent tax relief to Minnesotans.
Today, we are very excited to roll out and propose the largest tax relief package, the largest tax cut in our state's history. You all have maybe heard that the state has a surplus, $7.7 billion. And when you have a surplus this large, it means one thing, and that's the state of Minnesota is collecting too much money from the taxpayers. And Senate Republicans have heard loud and clear from the people of Minnesota, send the money back. Get that money back in the pockets of Minnesotans. And today, our proposal is going to do exactly that. We are proposing permanent, ongoing tax relief so working Minnesotans have more money in their pocket every single paycheck, week after week, month after month, year after year.
Minnesotans are struggling. While our government accounts are full and overflowing, Minnesotans' bank accounts are struggling. We are one of the highest tax states in the country. And one of the most valuable things that we can do right now to help struggling Minnesotans is to deliver immediate, permanent tax relief. Lowering the tax burden on all income tax filers and eliminating the double taxation on Social Security benefits on that income that Minnesotans already purchased when their paychecks were taxed. We can get Minnesotans on the right track, and we can provide immediate, efficient, and permanent tax relief.
And the Transportation Committee advanced legislation that would dedicate all sales tax collected on auto parts and repairs to roads and bridges.
If we put some more money into HUTDF and spend that money on roads and bridges, number one, we are going to generate economic development in the business community, and number two, we are going to have a significant amount of good construction jobs for the trades. And I see nothing but good that comes out of both of those ideas.
Right now, small cities, which are the greater majority of the cities in my district, get no funding on an ongoing basis. And I think that's the biggest thing that we face here is local towns and the townships and the small cities do not get enough money to keep their road network up.
This is what we need. We need different sources of revenue that are stable, that grow over time, and the auto part sales tax is one that just makes common sense.
Minnesota has the 5th highest number of public roadway miles in the country. We're number 5, which makes a lot of sense when you consider that Minnesota is primarily an ag-based economy. You need a lot of road miles to get goods to market. Second, the Minnesota State Highway Investment Plan has identified nearly $25 billion in unmet road and bridge needs over the next 20 years or so.
Dedicating those funds on a year-by-year basis allows contractors to ramp up and hire more employees, maybe see some new businesses come out of this.
We have not actually acknowledged where this money is coming from. The money is coming from the piggy bank that funds the rest of the budget.
I can't recall when we've had contractors and laborers and communities and advocates all on the same page around the need for this bill.
I agree very strongly with the sentiment that it needs to be dedicated, reliable, and long-term in nature. And because it's not constitutionally dedicated, it is this sort of resource is at some risk in future budgetary years when other priorities for the general fund emerge.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.